Welcome back, everyone, to the Deep Dive. Ready to get our neurogeek on?
Always ready.
Today, we're tackling electrodiagnostics, EDX for short. Specifically, how it helps us with dogs who have spinal cord or cauda equina problems. And, full disclosure, we're leaning hard on a seriously in-depth review article from the Veterinary Journal for this one.
It's a beast of a paper for sure.
So, picture this. You're seeing a patient, suspect a spinal issue, you've got the imaging.
Yeah.
But you still want more info, right? Like functionally, what's going on with those nerves? That's where EDX comes in.
Imaging is essential. Absolutely. Gives us that anatomical picture. But EDX, that's where we get the functional data, how those nerves and muscles are actually working.
I gotta admit, I always thought EDX was mostly for like your classic neuromuscular diseases. This spinal cord application, this is a whole new level for me.
Yeah, it might surprise people how versatile these tests are. We're so used to going straight for the MRI, the CT scan.
Right.
But in some cases, EDX can be crucial even before we get to that point. It can literally tell us, hey, is the spinal cord even involved here? Which totally changes our whole diagnostic path.
Makes sense. Think about a dog with, say, unexplained lameness. EDX could be the thing that points to a nerve problem, could save the owner an expensive MRI if it's not actually spinal.
100%. So let's get into the nitty-gritty of some of these tests. The paper goes deep on motor and sensory evoked potentials, MEPs and SSEPs. I don't know about you, but I could use a refresher. Walk us through it. Think of MEPs and SSEPs like testing the communication lines between the brain, the spinal cord, and the muscles.
Okay, hold on.
MEPs, those check the motor pathways, the signals going from brain to muscle, telling the muscle to contract.
So the move command, basically.
Exactly. And one way we do this is with transcranial magnetic stimulation.
Transcranial. Whoa, that sounds intense.
It's not as scary as it sounds. It's painless for the dog. Basically, we use a magnetic field to stimulate the motor cortex that's up in the brain, and then we record the electrical activity from specific muscles.
And which muscles are we talking about?
Depends. For the front legs, we usually use the extensor carpi radialis muscle, and for the back legs, it's the tibialis cranialis.
Got it. So zap the brain, see how fast the message gets to the muscle. What about SSEPs then?
SSEPs are kind of the opposite. Instead of going brain to muscle, we're going from the periphery inward. We stimulate a nerve, like the tibial nerve in the hind leg, and then record the signal as it travels up the spinal cord to the brain.
So it's checking the sensory pathway.
Exactly, like tracing the route of a sensation.
And I'm guessing you don't always use the tibial nerve?
Nope, we can stimulate other nerves too, depending on what we're looking at. Ulnar nerve, radial nerve, even the tail nerve sometimes.
The tail nerves. That's wild. So we've got the stimulation happening, but what does it actually tell us in the clinic? Like, how do we interpret these results?
The cool thing about MEPs and SSEPs is they're super sensitive. We can pick up on really subtle nerve dysfunction.
Even if the dog isn't showing obvious symptoms?
Yep, even then. Like, think about those dogs with back pain from a thoracolumbar disc extrusion. Even if they're still walking okay, we might see abnormal MEPs.
So it's catching those early changes. That's amazing.
It is. SSEPs in particular can be really good at telling us if a dog has a spinal cord problem, even if they're still walking around. We can differentiate healthy dogs from those with disc disease or other myelopathies.
Wow, talk about early diagnoses. I bet that gives owners a lot of peace of mind.
Definitely. It can. And sometimes these SSEP readings can even give us clues about whether a dog will regain function, like walking or controlling their bladder and bowels.
That is the burning question for a lot of owners, for sure. So we've talked a lot about back problems. What about neck issues? Those are pretty common too, right?
Absolutely. And we can use MEPs for those cases too, like in dogs with cervical spondylomyelopathy. Right, CSM. We often see abnormal MEPs even if the only sign is neck pain.
So again, catching things early. These tests are powerful, but are there any limitations? When are they not helpful?
Well, if a dog is severely affected, like paralyzed, the MEPs might be absent altogether.
Makes sense, if the signal can't get through at all.
Exactly. And while we might still get SSEPs, they don't always tell us how well the dog will recover. But here's where things get interesting. Even in dogs with chronic paralysis, we sometimes see MEPs and SSEPs below and above the injury, even years later.
Really? Even after all that time? But doesn't that mean the spinal cord is still connected in some way?
It suggests there might be some functional tissue remaining. Now, the data isn't crystal clear, and these signals don't always mean the dog will regain function, but it's definitely intriguing.
Wow, that opens up a whole other line of questions about potential therapies. Speaking of which, I'm curious about intraoperative monitoring like they do in human spinal surgery. Is that a thing in dogs?
It's not common, but it is possible. There have been studies using SSEs to monitor spinal cord function during surgery, particularly decompressive procedures.
So they're literally watching the spinal cord's activity while they're operating.
Yep, real-time monitoring. It's routine in human surgery, helps prevent damage. Could be huge for complex canine procedures, but logistically, it's tricky.
I can imagine. But the benefits are pretty clear. All right, one more thing I wanted to touch on. The article mentions cord dorsum potentials, CDPs. What are those all about?
Think of CDPs like listening in on the spinal cord's incoming mailroom. They show us the activity in the dorsal nerve roots and the dorsal horn of the spinal cord. That's where sensory info first enters the central nervous system.
Okay, that's a helpful image. So purely sensory.
Yep, no motor component involved. We usually stimulate either the tibial nerve or the tail nerves and record over specific vertebrae in the lower back.
Sounds pretty specific. So how does CDPs actually help us in practice, like with real patients?
They're especially useful for lumbosacral disease, particularly in dogs where pain is the main issue.
Because pain is so hard to assess in animals, right?
Exactly. Studies have found abnormal CDPs in dogs with lumbosacral pain, even if their neurological exam is normal. And the time it takes for that CDP signal to travel, they can even tell us if there's foraminal stenosis at L7-S1, which is a common spot for nerve compression.
So it's like we're using EDX to pinpoint the exact source of pain.
That's a great way to put it. And here's the key. CDPs, when combined with an MRI, can tell us if the stuff we see on the image is actually causing the pain or if it's just incidental.
So it's not just about what the picture shows, but about whether those anatomical changes are actually the problem.
Exactly. EDX gives us that crucial functional context.
This is blowing my mind. Okay, last question for now, I promise. The article also throws around these terms, F-wave and H-reflex. Help me out here.
Both of these are what we call late responses after we stimulate a nerve. They show up later than the initial muscle response.
All right, and the difference is?
The F wave is purely motor. So we stimulate the nerve, the signal goes up to the spinal cord, and then a tiny part of it bounces back down the same pathway to the muscle.
Like an echo.
Perfect analogy. It tells us about the entire length of the nerve, including the tricky proximal part, the nerve roots, and even how excitable those motor neurons are. The H reflex, on the other hand, that's a true reflex. It involves both sensory and motor pathways. We stimulate a sensory nerve, the signal goes to the spinal cord, and then it's reflected back through a motor nerve to the muscle.
Okay, so both are checking the nerve and nerve roots, but the H reflex is also looking at the sensory side of things.
Exactly. Now, the million-dollar question is, how do we actually use these in the clinic?
Yeah, that's what I'm dying to know.
Well, in humans, they're used a lot to figure out if nerve roots are involved in lumbosacral disease. For dogs, research is still catching up, but there's growing evidence they can be super helpful for us too.
Can you give us some examples?
Sure. For instance, studies have shown that a delayed F wave can be a sign of lumbosacral foraminal stenosis in dogs.
So again, helping us zero in on the location of the problem. What about for actual spinal cord injuries?
Well, in dogs with acute disc extrusions in the thoracolumbar region, we can look at the F-wave duration. It can help us understand how much motor neuron disinhibition is happening.
Whoa, hold on. Motor neuron disinhibition. That sounds complicated.
Basically, it means those lower motor neurons in the legs are firing without the usual control from the upper motor neurons, which are damaged in the spinal cord. The F-wave lets us measure how much of that is going on.
That we can measure that at all is just mind-blowing. What about the H reflex? Any use for that in spinal cord injury?
Yes. In dogs who've been paralyzed for a while, a more excitable H reflex is actually linked to better motor function. And it can even predict how well they might respond to certain drugs, like 4-aminopyridine.
So potentially we could tailor treatment based on these EDX findings.
Exactly. Personalized medicine for the nervous system.
This is incredible. All right, I need a minute to process all this, but before we go too far down the rabbit hole, let's switch gears for a second. We got to talk about EMG.
Ah, yes, electromyography, getting down to the muscle level.
Exactly. So remind me, what is EMG actually measuring?
It's looking at the electrical activity of muscles. Basically gives us a window into how well those muscles are working, and it can tell us if the problem is within the muscle itself.
A myopathy.
Right, yeah. Or if the issue is coming from nerve damage, which we call denervation.
Okay, got it. But how does this help us with spinal cord or cauda equina problems? Those are nerve issues, right?
Think about those nerve roots, the ones branching out from the cervical and lumbosacral areas of the spinal cord. EMG can assess those roots and pinpoint the source of dysfunction.
So if a dog has weakness or muscle atrophy, EMG can help us figure out if it's a nerve root problem.
Exactly. Now, EMG findings in lumbosacral disease can be a bit tricky to interpret.
How so?
Older studies showed a pretty clear connection between EMG abnormalities and lumbosacral disease. Like, the more denervation in the muscles, the worse the nerve compression. But newer research is showing it's not always so straightforward, especially if pain is the main symptom.
So EMG alone might not give us the whole story in those cases.
Right. We always have to look at the big picture. But EMG is still super useful for other things, like diagnosing peripheral nerve sheath tumors.
PNSTs.
Yep. It can help us tell if lameness is caused by a PNST or something orthopedic. And it can even tell us if the tumor has invaded the spinal canal.
So it can guide treatment in those cases? Any other uses for EMG with spinal conditions?
There's some research suggesting it might help us track the progression of degenerative myelopathy, but we need more studies on that.
Degenerative myelopathy, that's
Heartbreaking.
the canine version of ALS, right?
It is. And that actually brings us to our last EDX technique for today, motor unit number estimation, or MU.
MUNE, that one's new to me. What is it actually measuring?
Imagine every muscle is made up of tons of these tiny motor units. Each unit has one motor neuron and all the muscle fibers it controls. MUNE basically estimates how many of these units are actually working in a muscle.
So it's like counting the functional units within the muscle itself.
Exactly. It gives us a really detailed look at the health of both the motor neurons and the muscle fibers.
Wow. Okay, how do you even do that in a dog?
There are two main ways. Incremental and F-wave based. They both involve stimulating nerves and analyzing the muscle response, but the calculations are a bit different.
So all very technical. But what about clinically? How are we actually using MUE to help patients?
Honestly, MUNE is still pretty underutilized in vet med. It's mostly used in research right now.
But there's potential, right?
Oh, tons of potential, especially for conditions like, you guessed it, degenerative myelopathy.
Canine ALS.
Right. Early studies haven't shown super clear changes in MUNE in dogs with DM, but we need more research. In humans with ALS, though, MUNE is used to detect those early signs even before the disease is obvious clinically.
So the hope is it could do the same for dogs.
Exactly. Earlier diagnosis, better management strategies. It's an exciting area.
It is. This whole EDX thing is way more than I ever imagined. It's amazing how many tools we have to assess these complex cases.
And we're just getting started. There's actually one more technique we need to talk about.
Ooh, there's more. Now I'm really intrigued.
You should be. We're going to dive into nerve root stimulation next.
Welcome back to our deep dive into electrodiagnostic testing for those tricky spinal cord and cauda equina cases in dogs.
My brain is still buzzing from all those techniques we covered, but you mentioned something about stimulating the nerve roots directly.
I did. It's called, well, nerve root stimulation. Pretty straightforward name. And it's basically an adaptation of those motor nerve conduction studies we all know and love.
MNCS. Stimulate the nerve at different points, see how the muscle responds.
Exactly. But with nerve root stimulation, we're going right to the source. Instead of stimulating the nerve along its path, we're targeting the nerve root itself, right where it exits the spinal cord. So we're getting a really specific look at that particular nerve root. Cool. But how do you even do that? Like, anatomically, how are you reaching it?
It does involve some precision. We're talking about inserting a needle electrode near the intervertebral foramen. Specifically for the L7 nerve root, it's the L7S1 foramen. That's the opening where the nerve root leaves the spinal canal.
L7. Makes sense given how common lumbosacral disease is in dogs.
Right. So we get the needle in position, and then we deliver a tiny electrical current to directly stimulate that nerve root.
And then what? What are we measuring?
We look at all the same stuff as in a regular MNCS. Latency, amplitude, how the muscle response looks, motor nerve conduction velocity. But the key here is that we're stimulating the root directly, so we get a clearer picture of its function without the influence of the rest of the nerve.
So it's more isolated. You mentioned earlier that F-waves can be tough to get sometimes.
Yeah.
Is this technique better than trying to use F-waves?
It might be. Remember, F-waves, those rely on stimulating the nerve further down, and not all of those motor neuron axons actually contribute to the F-wave. Makes it a bit less reliable, especially in dogs. Direct nerve root stimulation could be more consistent, give us clearer data.
Makes sense. And has this been done in dogs before?
It has, and the early research is promising. We're seeing that it can be very accurate and sensitive, especially compared to EMG and traditional MNCS.
I like the sound of that. More accurate, more sensitive. Means we're getting closer to the truth. So right now, it seems like this technique is mostly for lumbosacral disease.
That's where most of the research is focused, yeah. But think about the possibilities. We could use this to assess nerve root involvement in all sorts of spinal conditions, disc disease, tumors, even before or after surgery.
Whoa. Imagine being able to check the health of each individual nerve root. That's powerful stuff.
It is. It's still early days, but I think nerve root stimulation have the potential to revolutionize how we approach these cases.
I'm with you on that. All right, so we've covered a ton of ground here with all these EDX techniques. It's clear that this goes way beyond what we typically think of with neuromuscular diagnostics.
Definitely. We're not just talking about generalized nerve and muscle problems. We're using these tools to really understand what's happening within the spinal cord itself.
And while imaging, like MRI, that shows us the structure, the anatomy.
Right.
EDX is giving us the functional side. How are those nerves actually responding to those structural changes?
Couldn't have said it better myself. And that's critical for making the right diagnosis and choosing the best treatment.
Before we move on, though, I want to circle back to a couple of things we talked about earlier, specifically MUE and EMG.
Ah, yes. Motor unit number estimation and electromyography. Two powerful tools, especially when we're dealing with spinal cord and cauda equina issues.
Right. MUA, that's all about counting those functioning motor units in the muscle, like taking inventory of the muscle's workforce.
Exactly. And remember, it can be incredibly sensitive.
Yeah.
We can pick up on very subtle motor neuron loss.
Which is huge, because in humans, that's a hallmark of conditions like ALS, Lou Gehrig's disease.
Right. And in dogs, the research is still early, but there's a lot of excitement about MUNE's potential for degenerative myelopathy, canine ALS, as we've been calling it.
And degenerative myelopathy is, well, it's devastating. No cure, progressive. Early diagnosis is everything, but it's tough.
That's where MUNE could really change things. In human ALS, we can see changes in motor unit numbers before any clinical signs show up. Imagine if we could do that in dogs.
Identify those at risk, diagnose it super early. That would be a game changer.
It would. We could start interventions sooner, potentially slow down the progression, improve quality of life. More research is needed, of course, but the possibilities are huge.
They are. Okay, and then there's EMG. We talked about how it helps us differentiate between muscle problems and nerve problems, especially those tricky nerve root issues.
Right. And don't forget about its role in diagnosing those peripheral nerve sheath tumors, PNSTs. They can mimic orthopedic problems, make it hard to know what's really going on.
Yeah, this can be tough.
But EMG, it can show us those signs of denervation. Tells us the nerve supplying the muscle is damaged, helps us make the right diagnosis, get the dog the right treatment.
And sometimes EMG can even tell us if a PNST has invaded the spinal canal, right?
It can. By looking at those paraspinal muscles, the ones running along the spine, we can get a sense of how expensive the tumor is if it's impacting the spinal cord itself.
So helpful for diagnosis and surgical planning. Amazing. All right, before we wrap up this EDX extravaganza, I have to ask you about one more thing. The H reflex.
Ah, the H reflex, that wonderful reflex arc with its sensory and motor component.
Right. We talked about how it's different from the F wave, how it gives us a look at that reflex pathway. But I'm curious, what's its role in, say, spinal cord injury? Does it tell us anything useful?
It does. In fact, the H reflex has emerged as a potential biomarker for recovery.
A biomarker, meaning we can use it to predict how well a dog might recover.
Potentially, yes. Studies in dogs with chronic spinal cord injuries are showing that a more excitable H reflex is linked to better motor function.
So the stronger the reflex, the better the prognosis.
In a nutshell, yes. And what's even more interesting is that the H reflex might be able to predict how well a dog will respond to certain meds, like 4-aminopyridine, which is sometimes used to improve function in these patients.
So we're talking about using EDX, not just for diagnosis,
Right.
but to guide treatment decisions, maybe even personalized therapy based on a dog's unique physiology.
Exactly. It's a glimpse into the spinal cord's ability to heal and adapt. And the more we understand those mechanisms, the better we can tailor treatment to each individual patient.
Welcome back for the final installment of our EDX deep dive. I'm feeling like a walking, talking EMG machine at this point.
I'm right there with you.
Yeah.
So we've dissected all these individual techniques, but now let's talk practicality. How does this all come together when we're actually trying to help a dog?
Right. Real world scenarios.
Yeah.
So let's say you've got a dog coming in, back pain, maybe a little wobbly on the back legs. How does EDX fit into your workup?
Honestly, it can be super helpful even before we jump to advanced imaging, like an MRI.
Because these tests are so sensitive,
Right.
even to subtle changes.
Exactly. Especially those MEPs and SSEPs, those long pathways. Even if the dog's neurological exam isn't screaming spinal cord problem, we might see delays, reduced signal amplitudes, things that make us go, something's not quite right.
Like a little red flag waving.
Exactly. And the beauty of EDX is it doesn't just say yes or no, it helps us narrow down where the problem is.
So instead of blindly poking around, we've got a roadmap.
Precisely. Those EDX findings, they guide our next steps. Maybe we focus our imaging on a certain spot. Maybe we run specific blood work to rule other things out.
It's like detective work for the nervous system.
I love that. And here's another thing. EDX can be helpful even when imaging does show us something. Like, let's say we've got that classic herniated disc on an MRI.
Right.
The MRI shows us the what?
Yeah.
The structural problem. But EDX tells us the how. How is that disc actually affecting the nerve?
It's bridging that gap between anatomy and function.
Exactly. So we might see that disc compressing a nerve root, but is it functionally significant? CDPs, F waves, those can tell us.
Is that disc really the bad guy, or is it just a bystander?
You got it. And this is where EDX is so powerful for lumbosacral disease, because let's be honest, those cases can be a real puzzle.
Oh, tell me about it. Sometimes you see things on the MRI and you're like, is this really what's causing the problem, or is it just there?
Exactly. EDX helps us avoid unnecessary treatments, unnecessary surgeries, by making sure that what we're seeing is actually clinically relevant.
So it's not just diagnosis, it's guiding our whole management plan. And this also ties into prognosis, right? We talked about how SSEPs might be able to tell us if a dog with a spinal cord injury will walk again, control their bladder.
Absolutely. And even in those chronic cases where the dog has been paralyzed for a while, EDX can offer clues.
Like, give us a glimmer of hope when things seem hopeless.
Sometimes, yeah. There are certain findings, like those MEPs or H reflexes we talked about, that might suggest a dog has a better chance of improvement with rehab, with certain medications.
So instead of just saying, this is it, there's nothing more we can do, we're using EDX to identify those dogs who might still benefit from intervention.
That's the goal. Hope and tailored treatment plans. It's like personalized medicine for the nervous system.
This has been an incredible journey. I feel like I've learned more about EDX in the past hour than I have in my entire career. And it's clear that this field is just going to keep exploding. What are you most excited about for the future of EDX in vet neuro?
Ooh, that's a tough one. But I gotta say, intraoperative monitoring is huge E. Using EDX during spinal surgery to protect the spinal cord.
We touched on that earlier. It's routine in human surgery, but not so much in dogs, right?
Right. But I really believe it's going to become the standard for us too, especially for those complex spinal procedures.
Imagine watching the spinal cord's activity in real time, adjusting things as you go to prevent damage. That's incredible.
It is. And I think MUNE also has a ton of potential. Being able to detect those tiny losses of motor neurons, that's going to be huge for diagnosing and monitoring conditions like degenerative myelopathy.
Catch it early, maybe even before those clinical signs show up.
Exactly. We're talking about potentially changing the course of these diseases. It's a whole new frontier.
I am so fired up about this. All right, everyone listening, if you're not already geeking out about EDX, I don't know what to tell you. This is the future, people. Dive in, learn all you can, and let's keep pushing the boundaries for our patients.
Couldn't agree more. From Vet Neuro Jar, keep those minds inspired, hearts light, and tails wagging.